Good morning, everyone. My name is Robert Hersey. Happy Wednesday to each of you, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled The Changing Landscape of Alcohol. This webinar is being made available through a collaboration of the Florida Department of Children and Families and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and are only able to view your name. Your webcam and microphone have been disabled. If you have questions, please send them to the presenter and me, the host, FATA Webinars, by using the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio at any time during today's presentation, there are a few options to try using the Communicate menu. One of these options is on the screen now, and all of the options are posted at the top of the chat panel as well. After ensuring your volume, both on your computer and external speakers if applicable, is not lowered, you may click the Communicate menu, then click the Audio Connection panel. Click Disconnect, follow the first two steps again, and then click Call in using the computer and follow the instructions. If you continue to experience poor audio through your computer, try using the I will call in option under the Communicate menu. The access code and event password are on your screen and in the chat panel as well. You must be connected to the audio of this presentation as well as view it on screen to receive a certificate of attendance. We are unable to verify attendance if you are not connected to WebEx via your computer or mobile device. Therefore, audio-only attendees will not be eligible for a certificate of attendance or CEUs. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and PowerPoint, visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FATA website. You will first need to register or sign into your account to complete the evaluation. Please ensure that your name and email address match your webinar attendance. Information you provide FATA as part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the entire webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close at midnight on Monday, February 19th, 2024. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors the arrival and departure times of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. We encourage you to complete the survey as soon as possible. If you experience technical difficulties accessing the survey, please fill out a contact form at www.fata.org or email training@floridabha.org before the evaluation closes. This presentation is intended solely for educational purposes. The views, opinions, information, and content expressed in the presentation are those of the presenter and do not necessarily reflect the views, opinions, or policies of the state of Florida, the Florida Department of Children and Families, the Florida Alcohol and Drug Abuse Association, or the Florida Behavioral Health Association. Attendees should note that sessions are recorded and published in various media. Our presenter today is Kathleen Roberts. Kathleen is the Chief Executive Officer for the Community Coalition Alliance, Incorporated. She has more than 15 years of experience in behavioral health at the local, regional, and state levels. In her role at CCA, she works with community coalitions, providers, and partners to assess substance use trends through data collection and analysis, conduct research, partner engagements, capacity building, and community assessments. Ms. Roberts also provides ongoing technical assistance and training and serves as a master trainer for Florida with the Substance Abuse Prevention Skills Training Curriculum, supported by the Substance Abuse and Mental Health Services Administration. Prior to joining CCA, she worked at the Florida Department of Children and Families Office of Substance Use and Mental Health, serving as the clinical team lead, Florida's National Prevention Network designee, and the State Epidemiology Work Group lead. She received her Master of Science in Criminology from Florida State University and a Master of Science in Criminal Justice from the University of Central Florida. And now I would like to welcome our presenter, Ms. Kathleen Roberts. Kathleen, I will turn it over to you.
Excellent. Thank you so much. And thank you very much for the opportunity to be here today. I want to thank the Department of Children and Families as well as FATA for this opportunity to share out some information around this important topic. I know it's very hard to focus in when we have so much attention happening around the opioid crisis and fentanyl, but we have to remember that alcohol continues to play a major role in our communities and a major impact on the health and wellness of individuals and families and communities. So I'm excited to be able to talk a little bit more about what that looks like, what we've seen. And so with that, we're going to go ahead and get started here. So first, I want to tell you a little bit about who I am and whom I'm with. Kathleen Roberts. I'm the CEO for Community Coalition Alliance. We are a coalition of coalitions. Our mission here is to serve as a collective voice of community coalitions and partners working towards the health and wellness of all Floridians. By bringing together coalitions and partners from across communities, both rural and urban, similar and different, this collective allows for the opportunities to leverage efforts, leverage ideas, and leverage opportunities. These efforts allow our various members to come together to really work on what our vision is, and that is of communities working together to provide Floridians a healthy and safe environment in which they can thrive. And that's really what we're all trying to do, is to be able to create a place for all of us to have our families, our friends, our loved ones, our colleagues and workers, to be able to flourish and be able to be the best person they can be. What we do here at CCA is a little bit of everything. We provide the opportunity for membership to bring together our various coalitions, partners, and community groups so that we can have some consistency in messaging. We can discuss issues and barriers. We go through to brainstorm on what are some of those next steps when we try to see what's happening out in our communities. We also have opportunities to provide funding and oversight. We do a lot of training and technical assistance. We offer a lot of courses around not just behavioral health, but also for skill sets that might be needed in order to reach out to more community partners, to mobilize, to build up teams, to really be able to increase that awareness, bringing in education, and then also being able to allow for the resource distribution that's needed. And then we also do a lot of partnership engagement. The best way that we can make an impact is to connect with as many different partners as possible, even those that are the non-typical partners and may not work in our arena of behavioral health, but they still can play a role in being able to help us connect with the community. So that's a little bit about who we are and what we do. We have memberships across both the Northeast and Southeast regions of Florida, but we really work with coalitions and partners all the way across. So I'm here today bit about the landscape of alcohol, what we have seen, what the trends are looking like, what are some of the connections to mental health and alcohol use, what are the things that have evolved and are new in our society today that we didn't have to deal with before, and it's bringing in some additional concerns. So by the time our conversation here today, we're going to hit these four objectives, and that's to increase the knowledge on the rising trends related to alcohol consumption, increase understanding of alcohol use on the impact of mental health, increase and advertisements that encourage alcohol consumption, and increase awareness of alcohol-related policy changes. Uh, I can answer questions along the way, so if you have something that you want to know about or get clarification on any particular slide, please feel free to type it into the chat. Will sometimes it'll be bring through the slides. So if I hold off on some of the questions, it's because we're going to go cover that with one of the upcoming slides. So with that, I'll go ahead and get us started. I'm going to turn my video off for a second so we can focus really on the slides. There's a lot of great information here. And one of the things I would like everybody to know is we've woven in through each of the slides the links. There are hyperlinks in them so that you can easily find where that information came from, in addition to the listing of the sources at the end of the slide deck. So with that, we'll get started. So with the dangers of alcohol consumption, we have tons of research that's out there that gives us the information about what those dangers are, what those risks are, what are the things that we need to be aware of. So what we know based on the research is that youth who begin drinking before the age of 14 are significantly more likely to experience alcohol dependence compared to individuals who wait until the age of 21. So that's huge. So even if we're not trying to completely stop individuals from having alcohol, because it is legal once you're the age of 21, the fact to understand and know what delaying the start of alcohol consumption, that impact on young people and their future is huge. Youth who drink alcohol are also more likely to experience other negative consequences, such as memory problems, legal problems, and impaired school performance. Youth who start drinking before the age of 15 are 7 times more likely to be in a motor vehicle crash after drinking compared to individuals who begin drinking after 21. Youth who drink are more likely to carry out or be a victim of physical or sexual assault after drinking compared to others their age who don't drink. So just understanding what the research already has told us, if delaying alcohol consumption to at least the age of 21 will reduce some of these negative outcomes. So having the conversation around alcohol continues to be really important. We know with the opioid epidemic, and we focus a lot on fentanyl, we can't forget just how important of an impact alcohol continues to be and why we want to address it. When we talk about why we shouldn't give alcohol to young people, it's not because we don't want people to have fun to have fun. It's because our research shows us if you can start consuming at a young age, you have all of these negative consequences that you're at a much higher risk to have than if you waited until 21. This information here comes from the 2022 National Survey on Drug Use and Health. From this survey, these are self-reports that are provided to a number of different questions. 17.5 million young people, young adults ages 18 to 25, reported that they drank alcohol in the past month. So that's about 50% in this age group. And when you break it down by what that looks like, we're talking about 8.5 million males, 9 million females, 805,000 Asian young adults, 1.8 million Black or African American, 10.5 million white, 506,000 young adults of 2 or more races, and 3.7 million Hispanic or Latino young adults. That's a lot of people, but it's just important for us to even understand what this looks like when we say alcohol has a large reach. So I know some of you remember back in 2020 when the world stopped for a little bit, we saw a lot of shifts and changes in patterns of consumption across multiple substances. And now I know we are here for year in 2024, but it's important to kind of highlight when we start to see some changes in our different consumption patterns. We were doing a lot of work during this time to look at what was happening as things were evolving in our communities, and what we found that in the surveys that were being done, in the data that was being collected, in the so many different pockets of data collection process, we were seeing increases in consumption patterns for all the different substances. But alcohol particularly was starting to really increase because one, it was legal, two, it's more available and easier to access. And it was just, we had also more ability to be able to get to that. So we saw that jump up quite a bit as we went through. I added this quote because I think it was really brings attention to why some of these things were happening. Severe illness, grief, isolation, disrupted schooling, job loss, economic hardship, shortages of food and supplies, mental health, and limited access to healthcare. Those were the things that we were seeing as that were influencing the consumption patterns of various substances, and particularly for alcohol. It wasn't just one thing, it was all of these, like the perfect storm. We saw a lot of isolation. We saw a lot of reduced interactions, social interactions in communities. We saw the loss of jobs. We saw a lot of things that we know already have an influence on substance use, but now they were happening all at once in a very large amounts. And so as we started to see what we were looking at for substance use trends, this shift started to see the patterns moving up and up. This particular slide here I thought was also very interesting. So thinking again back to that, Americans are using alcohol as a coping mechanism to deal with stress. Nearly 1 in 5 Americans report heavy drinking. And then if we look at the different demographic age categories, we see just how that can vary across. This includes here of those that report drinking, here's what they're reporting, whether it's 1 drink, 2 drink, 3, 4, or 5 or more. Looking across here, that the Gen X population, you can see just how much that age group really shows up in reporting 5 or more drinks, which is that heavy drinking. As we look at what's happening across here as well, you see that if you group some of them, really are seeing that impact of alcohol consumption. And now we're going to get into what does that mean? And the question will be, well, so they have a few drinks. Is that really that bad? Well, it kind of is when it comes to health consequences. So if we, again, take a look at what we were seeing change during the time, um, there's so much data that's coming out now that was pulling information from what was available, what we were seeing. And this here I included because it's such a big shift that happened in such a short period that we have to be mindful to know, even moving forward, when there are large impacts in community settings, when there's disruption in everyday life, when there's something that has a major impact, whether it's like a hurricane, whether it's a mass shooting, something that disrupts the everyday life, that has not just a impact in that short-term time, it does trickle on and have that longer term impact. So we're using this example of what we saw with the pandemic just to say when a situation in your community happens, you have to always keep an eye also on the substance use because those things have a relationship there. So looking back in 2020 of February, when we looked at the consumption patterns, then taking it out to April and then again in November, what the data revealed is that those increases continued. So for to April alone, you can see just how much just regular month increased from 36% then up to in November. The exceeding drinking guidelines increased By April, it was up 27%. By November, 39%. Binge drinking also increased. That from February to April went up 26%. By November, that number was 30%. So these jumps in patterns of consumption in short amounts of time periods have those long-term consequences that we are going to talk about here in a few slides on impact of health, on the impact of physical health as well as mental health, and also on our communities. Using the estimated of population here, we look at what were the changes that we saw for individuals who were drinking before this pandemic to November of 2020. We're talking about patterns of changes with 1 billion more drinks per month. We're talking about 14.6 million more people exceeding the drinking guidelines. We're talking about 9 million more people binge drinking. And what is also interesting during that we see in these different patterns is that this increase in drinking, especially for women, was significant. So you can see here, we included this stat that binge drinking increased by 42% for women. That's quite a big jump because it used to typically be that when we talk about substances for alcohol, it would be more for males. But now we're starting to see the change in that pattern. And we're going to talk a little bit more about that too. So as I mentioned, when we talk about the consumptions going up, it's not just about people drinking more. It's about what happens as a result of people drinking more. And when we look on the consequence data side, what we're seeing is that alcohol accounted for more than 65% of deaths from heart disease. The heavy drinking has been linked and associated with higher blood pressure, heart failure, stroke, and obesity. The largest increase in deaths for alcohol consumption is also for the age group of 25 to 39-year-olds. Now, when we think about mortality data and we think about loss of life, when we start thinking about 25 to 39-year-olds, this is a young age group population. This should give us all that moment to really pause and think about just what an impact that is having on our community. So when we say that drinking and engaging in continual drinking before the age of 14 leads to all these negative consequences as you get into adulthood. And now we're showing you that when we look at the mortality data, the category that's increasing the most is that young adult. We really are at a time that we have to address alcohol consumption, and we have to address how we bring in this awareness. The drinking and the excessive drinking has such an impact on not just some of those consequences of having like motor vehicle accidents or things like that. It's also related to death because of health complications. And what we're seeing is these increases are particularly for women. I tried to include several slides along the way here so that you could have a variety of different data sources. And again, within each of these, I've included hyperlinks. If you want to see more about where this article was published and what else it included or where the study came from, you can click in each one of these to take you directly to the data source. So the NIH, National Institute of Health, they revealed that health effects related to alcohol use have increased quite a bit. Death certificates listed alcohol as a major factor and went from 78,927 to 108,791, which is a 38% increase. I don't know why our little increase arrows moved over, but that's what that arrow is for. It went up 38%. And again, from their studies, they also reveal that the largest increase is for this young adult population of 25 to 44. Deaths due to alcohol-linked liver disease also increased by more than 22%. Now, when we talk about major impacts on the community, we're bringing in all of the different stressors that push and influence individuals to their drinking. And then we see the not only just drinking happening more, but the heavy drinking increasing more. And now we're seeing the consequences that result from that in such, again, a short window. We saw those jumps from 2020, from February to April to November. Now we're also looking at the mortality data that's happening, and we're seeing a significant increase. And this only happening from a 1 year window. Then we take the next year where those patterns continue to go up, which means the patterns that we're seeing in the medical examiner data for mortality, the things that we'll see through the hospital data, the things that we see through all these other consequence data sets, is those changes are showing up. And we're seeing more and more of an impact of alcohol consumption on individuals, families, and communities. This chart here provides you kind of a long-term trend of age-adjusted deaths from alcohol liver disease in Florida. As you can see, the trend was going up. We are starting to see a little bit of a downward turn. Here for Florida in 2022, the age-adjusted death rate from alcohol liver disease was 7.2 per 100,000. But we included this map of Florida so you can see, while as a state it's 7.2, there are definitely variations across counties where we have some counties with a much higher rate, as high up as 23 per 100,000. So take a look at where you're from and what you see here. That kind of gives you a little bit of an idea of which communities are having an even larger impact than others. We hope that this downward trend continues, but it's one of those things that we have to keep looking at the data. And again, this is only through 2022. We'll talk a little bit more about some of the newer data as we go through, but we have to keep an eye on it, and we have to look at what those mean. This I found very interesting and thought would be great to share out here. With the information that we share, we've talked about consumption, we talked about some of the consequences, and then I thought it would be interesting to look at how does this look across our various communities. So the list that you see here, there's 4. So I found an article that cited the cities with the highest alcohol consumption based on the health rankings. So the health rankings data set provide a number of different health-related indicators. They have it for every state and all the counties. So you can take a look at things that relate to like good health days. They have teen pregnancy, they have smoking, they have obesity, they have a variety of different health indicators included. So based on the information pulled from the health rankings, we see that out of the top 50 cities across the country, 4 of them are in Florida, and these are the 4 listed. So that includes the Deltona area, the Villages, Cape Coral, and Northport, Sarasota, Bradenton area. We included in here what indicators that they look at. So they look at percent of individuals who reported drinking excessively, and then also the percent of fatal car accidents that involve alcohol. So for those different areas of what that looks like. And I see we have some items here in the chat. Make sure I'm not missing anything. So yeah, surprising for the stats for women, and we'll get into a few more things I wanted to share out with you all here. Let's see, don't you think that habit and automatic pickup is a huge contributing factor? So we're going to talk about some of those things coming up. We will address that. And another one of, it's not surprising for women. They're the ones who had to stay home with the kids and not able to go to work. They lost so much during COVID. So yeah, so we'll talk more about what those impacts are, because that's definitely one of the reasons why we started to see that shift in pattern, the added stress, the added isolation, the added responsibilities and expectations all happening all at the same time kind of created this perfect storm. And then in addition to all of that, we'll talk a little bit about the availability and access also increasing, as well as marketing that's really been targeting women in our communities. And if anybody has any other questions, it'd be great to put that in there. Yes, the wine mom movement is definitely making a cultural thing where it's normalizing and it's almost like an expectation that that's just a part of momhood. So we'll talk also a little bit more about that in the next upcoming slides, and I've got some images to share with you of what we're seeing across our social media and what are some of those messages that we are being exposed to. So Florida and alcohol. So let's talk a little bit about that. We have a variety of different surveys that are self-reported questionnaires going out, as well as we have other data sources that we can pull information. And when we're trying to better understand a pattern of substance use, it's really important to look at multiple data sources so you don't get just a partial picture. So for adults, we have the Behavioral Risk Factor Surveillance Survey that provides some self-report data. Unfortunately, it doesn't do it every year to give us that information, but we do get at least the start of a picture. So for Florida, we had 18.2% of adults reported in engaging in heavy or binge drinking, compared to 15.5%. So you can see that jump just from 2020 and 2021. We see from 18%, from the 15.5% to 18%. And then we take a look at our young people. So we're fortunate for Florida that we do have the Florida Youth Substance Abuse Survey that is done each year, every other year with a county level estimates. And for Florida, again, if you recall, the first data slide we shared here was about the impact of young people drinking before the age of 14, what that impact looks like long term. So in the questionnaire, they do have that question to see whether young people are drinking, have started drinking before that age. So we have 14.1% of youth reported trying alcohol before the age of 14. And then 15.5% of high school students reported drinking alcohol in the past 30 days. Now, you may think, well, maybe that's not too much. But again, you have to think about what does that look like locally. So while we saw that for the overall, you can see I've included some of our higher percentages for the counties. We have Alachua reporting 21%, Dixie at 29%, Leon at 20%, Pasco at 22%, and Wakulla at 29%. Those are the counties with a higher reports of past 30-day alcohol consumption. So you can just kind of better understand what does this issue look like in your community. And then if we take a look at the medical examiner data, what we see here is that while the opioid epidemic is absolutely having a major impact, where fentanyl is the #1 cause of death for 18 to 44-year-olds, we still also see the impact of alcohol on this as well. So if fentanyl has been our priority because of the number of individuals that we've lost to that, and then we take a look at the numbers in the interim report for 2022, we see that 3,026 cases included alcohol, one of the most frequently occurring drugs. It was only 24 cases less than fentanyl. So I think we need to just pause there for a second. We know fentanyl is lethal. We know how much attention we need to bring to that. And then when we look at the data, we see that there's only 24 cases difference in that interim report, where it's also one of those most frequently occurring substances. The updated report has just been released, so the full year annual report for 2022 is out. And what it showed was for fentanyl, there was 6,230 cases involving fentanyl. And for alcohol, it was 6,196. So still, even in the annual report, we see that that continues to be a major impact with only 34 cases difference. So I keep highlighting this just to emphasize the importance of why we can't forget about this particular topic. It continues to have an impact. We know in the research what happens if consumption of alcohol begins at an early age. We see the patterns that have shifted since the pandemic and continue to. We see targeted specific groups that are having an even larger impact from this substance. And then we see things showing up in our medical examiner data for especially our younger adults with females. And we see the differences across counties, where there are some counties that have an even larger impact. So quite a lot to take away from this and a lot to digest. Um, this slide here gives you also the alcohol-related emergency department visits of what we've seen over time. It's important to never not focus on just one particular year because things can change. But if you look at that pattern over time, this is broken out by the different age categories. So you can see how some of them are grow a little bit a steeper rate, but we see starting here in the 2020s starting to go up in these emergency department visits. We continue to see, even though the pandemic, we moved from that. So we're talking 2021. We're still seeing the increase 2022. We're just now starting to see a little bit of a decline in the last 2 quarters of 2023. But that impact, that's change, took a long time for some of that to start coming down. Not to say that it will stay down. This is why we look at trends over time because things can change. But now we've talked about consumption patterns. We talked about some of the consequence data. So here we have some more of the emergency room visits to show you that impact over time. And then if we look at also mental health, we also see some interesting patterns happening for mental health related emergency visits over time. So it's as we see these patterns, it's good to see how they relate to one another. So if we start seeing one of them going up and then the other one there, that means we might be seeing a relationship between these two topics. And we'll talk a little bit about that in the next couple of slides. So one thing we haven't talked about so much yet is treatment. So if we take treatment episode data sets, this is looking at admissions to and discharges from substance use treatment services reported by this single state agencies. And for us in Florida, that would be the Department of Children and Families. So for Florida, alcohol use disorder resulted in 7,685 admissions of treatments back in 2021. So more recent data, but this is what we had available. But we try to show you over time since our 2020 what we're seeing in these. And when we look at those different treatment admissions, you can see alcohol is the leading substance related to these admissions with 40 per 100,000 compared to these other topics here. It's not that there's not more than one substance concern that people, but as you can see, alcohol continues to be the top one. So talk a little bit more about that relationship between alcohol and mental health, because it is quite complex. It's not as simple of a topic to see where those connections are and where is it a connection is before, after, during, all of these things. We're going to kind of unpack that a little bit. But I see we've got a couple more things in the chat here. Let me make sure I'm not missing any questions. So we've got a question: how do you properly gauge and measure excessive drinking if the behavior is only confined to weekends, 2 days per week? So we still talk about past 30 days. So even if it is only 2 days, we still have 4 weekends in a month. So we're still talking about multiple days. And when we talk about the excessive drinking and we talk about multiple days of those. So even if you're only limiting it to 2 days, it's still considered as the excessive drinking. And then when we show the monthly trends, those are talking about past 30-day trends, if that helps. And the next one about access, yes, you'll have access to the slide deck. And again, all of the slides have hyperlinks to the data sources, articles, or studies that have been mentioned in here. So if you want to find out more information, you can go to the source itself. And yes, the baby boomers retiring and continuing their lifestyle, but the body does not handle it well. So yes, we definitely see some of that influence on some of these consequences. A lot of people with mental health issues will also turn to alcohol when they do not have insurance or cannot afford insurance, or turn to alcohol to cope. And yes, we're going to actually talk a little bit about that here, because alcohol is used as a coping mechanism for some. And so that is one of the things that we talk about, is how to provide those supports and services when there are concerns around insurance and those things. All right, so alcohol use and mental health. The prevalence of anxiety, depression, and other psychiatric disorders is much higher among persons with alcohol use disorder compared to the general population. The most common mental health conditions that co-occur with alcohol use disorder include depressive disorders, anxiety, trauma and stress related disorders, and other substance use disorders, as well as sleep disorders. So those, according to the research, are the most frequently occurring ones that we see happen with alcohol use disorder. Um, so when we try to unpack this topic between uh, alcohol use disorder and psychiatric disorders, there's we want to make sure that we are not saying one is causing the other. It's that there is a relationship, and that there are increased risks for certain groups and individuals. So pre-existing psychiatric disorders may increase the risk of developing an alcohol use disorder, because alcohol, as the comment was made in there, is used as a way to cope with symptoms. Now, it's not to say that just because individuals may have a disorder that they are going to then also have an alcohol use disorder, but it does increase that risk because of the use of alcohol as a coping mechanism. At the same time, alcohol use, especially for young people and adolescents, may predispose individuals to develop psychiatric disorders. So we talked about in that very first slide about the use of alcohol beginning before the age of 14, increasing so many of those negative consequences, and this includes one of them. So alcohol use disorder and other psychiatric disorders often share genetic risks as well as environmental vulnerabilities. So things like the adverse childhood experiences, the trauma, all of those things have a relationship to increase that risk. And understanding that those things play a role is really important, especially when we talk about like primary care, and making sure that these kinds of topics are addressed and brought up, and questions are asked to really look into this more carefully before we see some of those negative consequences continuing on. So alcohol is oftentimes used as that coping mechanism. And I don't know if you can see the image that grades here, but on here you can see it's an image of a bottle of wine. And then you can see throughout there are little categories, almost looks like those hydration bottles where it says um, getting hydrated, quench your thirst. But this is here you can see the top says relaxed, confident, happy, sad. So this is often used as a way to try to move away from the negative feelings, to numb what's going on, to bring it, to reduce that anxiety, with the hope that this is what's going to get to happiness, relaxation, comfort. But that doesn't necessarily happen. In fact, it has adverse reaction, and really has seen some of those negative consequences for health wise, and oftentimes making some of these the reasons that people drink those issues even more of a problem. So, a model of care for co-occurring alcohol use disorder and other mental health disorders. This, I really like the way that this was laid out for as far as different points where in the field can have an impact on individuals that are needing care, that are needing treatment, that are needing support. So there are tools available that could be used in all these different areas. So whether it's primary care, an addiction specialist, mental health specialist, or mental health and addiction specialist, where having those screeners, having some way to ask about what's happening, why it's happening, to get to the point to determine that some support is needed. This shows where some of these specialties can come in and be a part of that care team to help so that we don't see all of those consequences we just talked about. So we're helping address the mental health side, but also not forgetting the impact of the alcohol use disorder. So if you're treating someone for mental health, it's really important to also bring up and the questions around substance use. How are they coping? What's that pattern of use? And it's interesting with alcohol, we forget that it is a substance. It is a legal substance, but it is. Um, we know with other substances like, oh, that's uh, an opioid, or it's a medication, or it's this or it's that. Alcohol can also continues to be a substance, and we need to be able to address that and talk about what are the negative health impacts on individuals, especially if you're working with individuals who also are dealing with mental health concerns. So if we bring in that those tools, the screeners, to help identify some of this, you're able to intervene and connect services before some of it goes further down with any of those health conditions, as and also to prevent some of the emergency room visits, to prevent the mortality, to prevent the uh, other diseases that can result as a result of excessive consumption. Um, This we included here. So we're talking on today about alcohol, and we're talking about mental health and kind of that relationship between the two. So I thought it was important to also kind of address that the rate of behavioral health professionals in Florida has increased quite a bit from taking a look at fiscal year 16-17 to fiscal year 21-22, which is great. The downside is we are still in a very short, we're still in huge amounts of needs for additional support in this field. It's great that it's increased, but there are still so many gaps out there for availability and for being able to have those professionals in all of the communities that we have. We have some communities with very limited resources because we don't have these professionals available there. So when we see things like this, it's like, oh wow, we're doing so great. We're increasing so much. We have seen that increase. It's just unfortunately, it's not enough to meet the needs of where we are. I see we've got a couple more comments here. Just want to make sure we don't miss anything. Okay, so it says you briefly touched on the percentage by ethnicity. Is there discussion on the correlation between culture and alcohol consumption? So we have a little bit about that. We haven't gone too much into specific cultures. I think you could do an entire presentation just on that, but we will talk a little bit about um, what we're seeing that may be influencing um, in our communities as far as why we see some differences with like females and their consumption patterns compared to others. We'll talk about some of the targeted messaging and those types of things, but not we don't go into too many specifics about particular subgroups and cultures, because I think that's a whole entire presentation in and of itself. All right, and let me see, make sure we got the other one. Okay, I think some of this other stuff we're going to get to with these other slides. So, the slide that we have here, this is mental health in Florida. The data from the household pulse survey distributed between February 1st to the 13th of 2023 shows that 32.3% of adults in Florida report symptoms of anxiety and/or depressive disorder, compared to 32. We're about this. We're at the same as the U.S. So it kind of gives you, we are in line to with the national statistics on this, but that's still quite a big piece of our population. Nearly a third of our population is reporting symptoms of anxiety and or depressive disorders. And so, and we're not talking about 2010. We're talking about last year. So last year, around this time, we have nearly a third of our population reporting that they have symptoms of anxiety and or depressive disorders. And then when we talk about reasons for consumption for alcohol, it's to deal and cope with the stressors, anxiety, and depression. So if we know that that's a reason some will use alcohol, and we know that there's a third of our population indicating that they have anxiety, depressive symptoms, we have a serious concern to bring attention and awareness to this topic for all the different communities that we're in. And here we have the share of adults reporting symptoms of anxiety and or depressive disorders who have an unmet need for counseling and therapy. So it's still quite a bit. Individuals, we saw the increase in number of behavioral health professionals available, but we know that that amount that we have is still not enough for what the needs are out there. And then we can see here that we have 23.6% are reporting that they're needing counseling or therapy but have not received it in the past 4 weeks. And then if we look at for young people, for adolescents, 11.1% of children ages 3 to 17 in Florida receive mental health care in the past year. And that's, also a piece that we need to think about. So if we're talking about mental health and the needs, and especially unmet needs, we're not talking about just adults, but we also are referring to children. And when we see alcohol as a mechanism to cope with things and deal with things, if we are not meeting some of those needs out there, and we see and the patterns that are increasing, this could really lead to a lot of issues that many of our communities will be continuing to struggle with. Um, This is the average out-of-pocket spending for adults in large employer health plans by with mental health, and then also without mental health. As you can see, the cost for services is much more what you spend, and this is for those with the insurance. And we saw several comments here about individuals leaning to alcohol because they're not able to get the services to help them address their mental health issues and concerns. This is an overall picture from 2021 with the National Survey on Drug Use and Health. So this is for alcohol use disorder. According to the survey of 2021, 9.8% of people age 12 or older in Florida were living with an alcohol use disorder in the past year. 9.8% of people age 12 and older needed but did not receive treatment for alcohol use disorder. And take a look at the young adult age group. So if you recall from our slide talking of the consequences, when we saw the group, the age category that had the most increases there was that young adult population. And now we're seeing here the that same kind of population is also the same group that is needing treatment but not receiving treatment. So a lot of these indicators have that uh, real big awareness of why do we need to talk about this issue? Why do we need to address it? Why is it important to find support and services? Right. So now we're going to talk a little bit more about how alcohol consumption patterns are affecting, especially for women, more in the recent years, what we're seeing in those changes and shifts. And I know I can see with some of the comments that were made in the chat there of the added stressors, the added pressure, the added expectations, and also the responsibilities when it came to 2020, but everything stopped. Kids were sent home from school. You still had your job if you had your job, or you didn't. Add that piece there. So as we start to see the impact in the community, not just locally but statewide and nationally, we start to see some of these shifts. This is a very interesting article. If you have some time, I included the link so you can take a look at it. Again, this is just from the time frame, taking a look at what are we seeing change. And according to the data that was being collected, even before the pandemic, the number of women drinking was already increasing. It's just the pandemic kind of jumped it up a little bit faster. So those patterns of consumption were already increasing before the pandemic, and then we just exploded it by bringing in all of these added stressors and situations in there. Here you can see the notation about the rates of women rose 85% from the 1999 to 2017. One of the largest increases were also among non-Hispanic white women. And that kind of trend continued on. So if we already saw the trend going up before the pandemic, then we see the pandemic that adds in extra stressors, job loss, isolation, pushing on the depression, anxiety. It was like the perfect storm to really see just how much that was impacting this particular population. So while 2020 may have exacerbated the problem, the data continues to show that these patterns are not really changing much. They're continuing to increase for many individuals, for many women. And what how we're seeing this evolve is through some of the data, the mortality data. So what we see with the medical examiner, we also see it with the reports of cancer. We also see it with reports of the cardiovascular disease. So it's not just in one area it's showing up. And then when we think about, well, what are the things that have been influencing? And so looking at the research, there's a number of different things that have been identified as influencers, because it's not one thing, it's multiple things kind of coming in together. One of the things is that delayed motherhood. There was a lot of information in this particular article that talked about motherhood use previously was seen as the stabilizing time frame where responsibilities. So when women were having children younger, it was keeping them from engaging in some of these drinking behaviors. But then we start to see the age when women were having children increasing. And so that delay in motherhood may be one of the reasons why we see increases in alcohol consumption. Another reason noted was that women also have higher rates of anxiety and depression. But then it's not just those issues. We also were starting to see the increases in memes, and we had a couple comments in the chat here about the new mom wine theme that we see evolving. And so as we start to see that, we see a lot of the memes on social media, advertisements, really kind of showing how alcohol is the way that women are able to continue on and get rid of the stress, cope with the stress, and be able to have a balanced life. We also started to see marketing start to really target women, very similar to the way the tobacco industry did when they released the Virginia Slims. A lot of the new alcoholic beverages, and we'll talk about that in the upcoming slides, are definitely focusing in and honing in on what speaks to women. What are the things that you see the shapes of cans looking different, smaller, slimmer, the advertisement about nutrition. Alcohol didn't used to always come with a whole nutritional label on there of low calorie, carb free, uh, to almost promote it as this healthy approach to really kind of speak to them of what interests them. Um, this is the chart here provides information on perceptions of great risk from having 5 or more drinks of alcohol beverage once or twice a week among individuals 12 or older. 47.5% of Floridians aged 12 or older believe there is great risk from having 5 or more alcoholic drinks 1 to 2 times per week. But if you think about it in the other sense, that means more than half don't see this as a great risk. Perception of harm is higher in Florida compared to the surrounding areas. So we can see that in the chart here. I really like when they have these graphics that give you visuals. So you can see not just number wise, but what does this look like? So we can see the lighter the color, the higher percent of the individual. So we can see what that looks like. So let's talk a little bit now about the marketing and advertisements. So we've talked about what we know from the research that consuming alcohol before the age of 14 puts you at a much elevated risk for a number of different um, risk factors and negative consequences and all those things. We know that we've seen shifts and changes in patterns of consumption. Um, some happening before the pandemic, but then once the pandemic hit, it really kind of escalated the impact and influence by bringing in the stressors, unemployment, um, economic barriers, uh, lack of access to treatment, lack of access to other services, isolation. And then we talk about what we're seeing on the health consequence size with the increases in cancer. We saw increases cardiovascular disease, increases in death. We talk about the emergency department visits, and so now we're going to change the topic a little bit into, well, how are we reaching the population now? What is going on when it comes to advertisement and marketing? What are the things that we've seen change that might be having an influence as to why people are consuming more, and especially for women? So with the pandemic, what also happened is we were really in not we already knew about virtual spaces and social media, but when all of a sudden that became your new environment to be in, we really saw the how much more connected people were to some information. And then with some of the marketing tactics, we started to really see a lot of pushing to normalize alcohol consumption. So the social media was really normalizing and minimizing the drinking and actually oftentimes even encouraging it. As you can see here, these are some of the memes that I've seen online about alcohol and consumption. Uh, the top one here with what day is it again? Oh, it's a day that doesn't matter because just have more wine. And you can see the home button there is the picture of a wine bottle and a wine glass. You see life's about balance, coffee on one side, wine on the other. Then the last one there, work is what happens between my coffee and wine. When those messages are the messages, yes, they look funny. And we're like, oh, that's a funny meme. But when that's the bulk of the messaging that's happening, it starts to change and shift the way we see alcohol, where it's now, this is just a normal part of your everyday life. You have alcohol, like it says here, work is what happens in between your coffee and wine. You get done with work and now it's time for wine. Especially, these are things that you saw a lot targeting women, especially moms, and bringing in the memes about the wine mom, as somebody had put into the chat there. So a lot of this stuff was really starting to kind of flood our social medias. And once you look at some of these, if they do show up on your social media, I've noticed that for myself. If when I look at things like this, all of a sudden, that's the types of messages your phone starts to show you on a very regular basis. So the more research I did on this, the more my phone started sending me more messages like this, no matter which type of social media I would be on. These are the things that would be popping up. We started to see a lot of the normalizing of it's okay, this is what we do. We happy hour isn't just on the Friday, happy hour is now every day. And so they would use even our, cartoon characters. Do you want to drink on FaceTime? The one there about the beer, I Googled my symptoms. Turns out I just needed beer. It's wine time. You can see somebody carrying out a giant, massive bottle of wine that's larger than the person. So this type of messaging on a constant basis is really starting to see a change and a reduction in perceived risk of alcohol consumption, and especially about excessive consumption. As that's the part that we want to focus in on, where it's not to say, oh, you can't drink, don't drink. It's more of you need to know what the health consequences are when excessive drinking is happening and when excessive drinking is happening on a regular basis. When we talk about excessive drinking, we're talking about increased risk for cancer, increased risk of cardiovascular disease, increased risk of liver disease, liver damage, emergency department visits, a number of other things. It's not about, no, you should not drink because it is a legal substance. It's about saying, you need to know what happens. Yes, that message of it's 5 o'clock somewhere, absolutely. And we start to really see a lot of that in the 2020 when the virtual community, it was turned into our community when we started doing Zoom meetings all the time, we did Teams meetings and even schools, everything was online. Everything, our new world was online. And so all of a sudden these memes started showing up and then it became kind of like this funny way to say stuff. But if you say something enough times, it then becomes normal and then becomes this is just the way it is. And any day that ends in Y is a day for wine. I mean, those kinds of messages. And so when we talk about social media, this is also something we start to see with the advertisements. Once you click on one advertisement, it kind of creates this algorithm to keep promoting those types of ads to you, no matter which platform you're in. So social media all of a sudden began targeting individuals to show where you can get alcohol or that you do need to get alcohol. These are some screenshots that I took. We've been doing some of this research for quite some time. So it's once you start looking at one ad or two ads, they send you that. You don't even have to look for them anymore. They just keep popping up. So I took some screenshots of things that I've seen come up. As you can see, that first one, stop scrolling, start drinking. Delivery, we drive, you drink. But when this becomes the only kinds of messages that you really start to see, none of them really promoting the health, wellness, or anything like that, we start to see the shift in how society sees alcohol. Alcohol already was on the low podium there of substances of concern because we see so much with fentanyl and opioids and all of that, methamphetamine, the stimulants. Is not something people think of when you think of substances. But as you see with the data presented, it definitely has a major impact. And now we see how this is continuing to even normalize it more and almost put it as like an expectation that you will have alcohol every day because why not? This is what the messaging is saying to us. And then we also start to see some of these social media pieces take on things for young people. We saw a lot of alcohol challenges, the alcohol challenge where they would pour in a bunch of different drinks and see who can drink it all. They had one where they would fill a giant jug, like a milk carton jug, and fill it with whatever liquor of choice, and then maybe a little bit of a mixer, and then they were going to drink the whole thing in one sitting. We also start to see a lot of challenges for young people back in the pandemic time. Could they dress up a little bit since we were all wearing masks and purchase alcohol? And many of them did. They videoed it and posted it on TikTok. So we are now pushing it to normalize, and we're able to normalize it in a way that this could send it out so quickly. Because that's the thing about the virtual setting and the virtual community. Information is instant access. So these things, as they were happening, these memes that we're pushing out, these TikTok challenges, they were being done and being sent out, and all of a sudden everybody had it. It's not something that takes time for people to see. And once one person sees it, then all of a sudden everybody sees it. Oh yes, the joy of algorithms. It definitely is a new way to target. It's a new way to really push whatever messaging. And we'll get to that for when we talk a little bit about, well, why do we see so much for women and how is that being done? We This was also an interesting time. So in the last couple of years, we've also started to see alcohol being infused in so many different products. Before we had your beer and wine, and then you had your liquors. I mean, alcohol was this liquid thing that you could consume. Now we can see alcohol in so many different products that are not just to drink. This, and I don't know if you can see where it comes from, but the very top, I tried to put that in there. So these are things that were showing up on the kids' activities blog. Now, think about that for a second. These are pictures of Jello shots with alcohol already in them. The alcohol content in these shots are as high as a glass of wine, not just a beer. I think these were like 13 point something percent. And so here we are promoting, and now let's think, who do you think they're promoting this to? We found this on a kids activities blog. So it's for usually women looking for activities for the kids. And now we're putting something fun. Oh, look, these fun little Jello shots ready to go. Anywhere you go, it's like the party in a bag. And in a way that it's normalizing it and making it accessible to all, and where to find them and how to unwind. As you can see, yes, these are for adults and are the perfect way to unwind after a long day, because there's, again, moving into reach the population to what speaks to them. Stress is speak long days. How do you deal with long days? You unwind. How do you unwind? You use alcohol. And if you don't like alcohol the way it tastes in the drinks, let's introduce a new way that you can have it through Jello. I see a comment here. And yes, and alcohol also in ice cream. We'll talk about a couple of these other products available as well. So there's a lot of attention catching. So here you can see some of the things that these are real pictures that I took from stores. We always try to incorporate not just what we're reading about in other places, but what are we seeing in our communities? Every year, our coalitions work on environmental scans so they can go to different stores that sell alcohol, and we have other things that we look at. But for the alcohol ones, taking pictures of what are the different messages and marketing tactics and things that we see, product placement, all of those things. As you can see here, it's one of the BOGO deals, buy one, get one free. But look at the name of the product, day drinking. That's quite interesting, day drinking. And then you take a look at the other one, which looks like a kid's toy, cell phone, something like to that effect. It's actually a flask, and it's right there in the wine section. So they're definitely trying to get attention, trying to normalize things. So when we call a drink day drinking and make it a fun, bright color, and now we're going to give you a sale deal, it's really much more enticing. And then if you're still feeling like, well, maybe we don't want to drink in the open, well, let me give you a concealing item that you can now get so that you can have that available. So again, these are real pictures from real stores. Everything looks more appealing. These items are being placed in convenient locations, like at the checkout. They make them in nice, fun colors, things that grab our attention. So again, these are real pictures from stores that some of our groups went to. The other piece that is interesting to kind of talk through and unpack is since we start to see these increases in consumption patterns, we also would think that we would see more issues that come with the negative consequences when you drink too much. So the hangover, the things that make you feel sluggish. So all of a sudden during this time of the, happy hour, virtual happy hours, all of these things, uh, we started to see new products emerging that claim that they would reduce some of those negative effects of overconsumption. So reducing the hangover so that you can continue to consume the larger quantity of alcohol. And they would promote this. It started off with, we started to see just a couple of them that started to come out in 2020. So these items were being promoted as the sunscreen for your liver, the um, the vitamins to help you. But when you look at them, they're intentionally these supplements or these um, products are specific for individuals who are wanting to drink more, but not have the negative effects like headaches, the sluggish feeling, the nausea, the lack of energy, all of those things. And then from the couple that we started to see at the beginning, we start to see other brands coming out with their own. So you can see those pictures are real products that exist, whether it's online or in the store. Also, what's interesting about these, so when we start to see these come out, I went to the store just to see if are there any ID checks? Are there any questions for purchasing? So you can buy any of these things that are intended to reduce the negative effects of drinking too much, but you can buy them no matter the age. It doesn't ring up. You don't have to be a certain age to purchase like you do for alcohol. So it's interesting that anybody can buy products that are intended to reduce headaches and hangovers, but anyone can get them at the store. The first one that's pictured in there, we saw that product being promoted so much online of the pandemic with so many different videos to really push the be bright-eyed bushy tail for your 9 a.m. Zoom meeting. Take some of these and you'll feel fine. And videos of all different groups. Every possible ethnic group was represented in some sort of every age population, younger, older, all of those to kind of show this is a product for all. As long as you want to keep drinking, you can use these products and you can continue on. So it's very interesting how these kinds of products that never existed are now available. So we've seen patterns increasing, the negative consequences increasing, the memes all over the place. And we'll talk here about the sales of alcohol. And that should also put the last piece of that picture together for us. But now we're also making sure that people can continue to keep up with this pattern of consumption by bringing you products that will reduce your negative effects. Um, like I said, we our coalitions do these environmental scans going into stores to see how things are marketed, placed, promoted, all of these things. So one of those products that is used to reduce those alcohol consumption effects, you can see they're strategically placed where you're where there's alcohol and it's pretty close instead of being in like if these are supplements they should be in like the pharmacy section, but notice here the placement is in eyesight of where the alcohol is, and somebody put in there about the alcoholic popsicles. That's exactly what you see on the aisle here. The one side is some wine and the other side is alcoholic popsicles. So And as you see, these supplements, as they call them, it's right there where like the Kool-Aid is, right where our kids get their stuff. So what kind of message are we sending here when we're starting to mix it in where your kids get their drinks for school? And then the other thing we started to see is the rise of the new it drinks. So summer of 2020 was still a very stressful time. The alcohol industry decided to uh, kind of try and reach a new market. Being able to provide out a new type of alcohol that wasn't around as much before. And so that was the year we saw the shift to a lot of these new fruity, low calorie, sleek looking drinks, canned cocktails. We already saw, the seltzer waters were becoming very popular. So they took that same kind of concept, but then applied it to the alcohol side where all of a sudden these available alcoholic drinks, seltzer drinks, the margarita in a can, spiked sodas. So we had spiked ginger ales, the spiked root beer. All of those started to really take on such a growth. And then the entire hard seltzer market, it tripled that year, reaching $1.3 billion. And it has continued to grow since then. Um, every possible brand now was making their own version of these seltzer drinks. They were becoming very popular. As you can see, the way that the cans are, they're fun, they're vibrant, they're colorful. They have the labels on there about the health pieces, not necessarily saying how it has negative health effects, but more of, oh, low calorie, zero carbs, uh, low sugar, all the things that really are speaking to a very specific population, trying to gain some new um, groups to start drinking that maybe didn't before because they taste good, they're light, they're refreshing. And then we start to see, some of you have mentioned there about the popsicles. So we had popsicles with alcohol in them, and the alcohol content was pretty high, much higher than the beers. So beers can be anywhere from like a 4.3 to like a 5.6, like the typical beers. And then you've got IPAs that are higher, but these were coming in with alcohol being as high as like 13.5% or more in some cases. So making them fun, vibrant. They don't even look like alcohol. In fact, these things look very much to the kinds of popsicles that my kids like. And that was also a problem. We'd go to a store, say, "Oh, can we have that popsicle?" No, that's not a popsicle for kids. And for little kids, I don't understand why wouldn't it's a popsicle. Why can't kids have a popsicle? And so it's really beginning to bring a whole new topic discussion for families to kind of talk through this and what this is and well, what are some of those dangers that we need to really be addressing. And then even the coffee fans started also to see some of these introductions of new products. It's interesting. We actually saw some of these types of products in the aisle where the coffee section is, because you can get like some of your uh, cold drinks in a can for coffee, and then we would see these spiked coffees in the same aisle instead of being in the aisle where the alcohol is. It would be in the same aisle where some of the coffee stuff is. So it started really coming up all over the place and different companies were now also diversifying their types of products to include things like this. And again, as you notice the way that these items look, they don't look like a can of beer. They look exactly like a regular um, cold coffee can that you would find in the coffee aisle. They just also happen to be spiked. Some of them say spiked, some of them it's very small print. It just depends. then we start to see each year they've added more and more to these new innovative drink flavors and styles. So first we had all these seltzers come through. Then all of a sudden we start to see the like sweet teas, lemonades, everything coming out in these fun, vibrant colors, slimmer cans, very much more of a fun look and feel, prettier pictures, and really moving away from looking like a typical can of alcohol, like a can of beer or any of those. And in a way where it doesn't even bring attention that that's what you're drinking because it looks like, well, any one of those regular seltzer waters. The difference is this has a lot of alcohol in it. And then as we continue to look at what else is evolving in that industry, we see the push for the singles. I don't know if you have seen these in your stores, but we've started to see them showing up in grocery stores and some of the other larger stores, like the Walmarts and things like that, where they're putting these smaller individual sized bottles in the checkout aisle or at the edge of an aisle, not always with the alcohol, but by itself. And you can see that sign is from one of the stores that we went to. It says, so mini options. Clever way to kind of say mini with the little mini bottles and available all over the place. Gas stations were having some of these. So really kind of bringing attention of grab and go. So the kind of bringing this as the last piece, we've talked about the consumption patterns, the consequences, the advertisements. We talk about the mental health piece with the anxiety, depression, the coping mechanism, what we're seeing, and now we add to that, and then also the different products that we've seen evolve, the look and feel of the alcohol, the cans, really pushing the positive health side of low carb, low calorie, low sugar, and the prettier, vibrant pictures and colors and all of that. And now we talk about we've also now added also availability and access to be much more than it's been before. So during the pandemic time, we saw a lot of policy changes happen, not just for Florida, but in other states. One of the things that we saw was the temporary to-go drinks were made available, but then also we had the delivery services. Now, delivery of alcohol has been around before the pandemic. It just, we saw more companies and become of coming in to be a part of that industry than ever before. And then we started with this temporary policy to allow businesses to uh, kind of deal with some of the issues that were happening at the time with limited seatings, store hours, all of those things to allow these to-go drinks. The sales of alcohol continued. So this chart here, what you can see is the alcohol sales starting going back as far as 2006 and kind of going up, and as you can see it kind of went down a little some in 2020, which is one of the reasons for some of the push for the temporary to-go drinks, being able to allow businesses to continue, so less of an impact on the economic side. But then the sales all of a sudden started going up and up and up, and we continue. So even looking at last year's numbers, the sales are continuing to grow. And part of it is the introduction to these new types of drinks. Part of it is the marketing to really push, promote, and really kind of be in your face on all of your social medias. And then being able to um, have these different options to get alcohol to you, whether you take it home with you from a restaurant, whether you order it from a restaurant, whether you order it from a store and they bring it to you. I see somebody also put in here alcohol sold in the movie theaters. That's absolutely that's something that wasn't there quite as prevalent before, and now we're seeing it in almost in many of the movie theaters that are around where I'm at. I think I don't think there is a movie theater where it doesn't have one here. So I'm in the Jacksonville area. Yes, we've just made it so much more accessible and available, and the industry continues to grow. Then we saw that temporary to-go drink become a permanent to-go drink in 2021. So that's passed and now is part of what we have here. So again, the access and availability has increased and is there. Uh, there are specifications for that, and we've included some of this information there as well as the link so you can read on what that is. There were some limitations of not exceeding 32 ounces in some of these to-goes, and so the to-goes are specifically for the restaurants, we're not talking about the deliveries from like the liquor stores and grocery stores. So these are from the restaurants. They need to be sealed with an unbroken seal. They cannot be consumed immediately for removal. Alcohol has to be also placed in a bag or a container where it's secure. It also has to have a date receipt for it. If it's transported in a motor vehicle, alcoholic beverage that is not in a container sealed by the manufacturer must be placed in a locked compartment, a locked trunk, or the area behind the last upright seat of a vehicle. So you've got all of these particulars in there. However, it's still now become a not a temporary piece, it's a permanent piece of now alcohol can come from your delivery of whatever restaurant you're ordering from, if that's something that they do. Then we've got the direct shipments. So not all states allow for shipments of alcohol. In fact, there are 6 here that we've listed out that do direct shipments of spirits. Then we've got 8 states that allow for shipments of beer and wine. And Florida is one that allows for those things to be available. We also have the delivery services, which will do that. I mentioned this part here. This is the bill that allowed the alcohol to-go drinks to become permanent. So as this became our also new normal, allowing for alcohol to be delivered and allowing for that as an option, we also start to see advertisement from restaurants themselves to promote that this was an available piece that you could get your alcohol when you order your pizza or your spaghetti dinner or whatever it is that you're ordering, that you now have the option to add to it these things. So when you call, this is when you order online, this becomes an option. And as you can see, when these are screenshots I've taken when we went to the websites themselves. This is what shows up on like the front page of that website. So you're going to a restaurant website to order food, and the first thing that you see on there is the alcohol, because that kind of brings in the enticement. So again, back to that targeted marketing and advertisement, similar to what we saw with the grocery store with the sales right there, making that available and grabbing the attention. And then we really started to see third-party delivery companies grow like crazy. Not everywhere, but particularly in the larger cities and communities, similar to what we saw with the availability of Uber. We started to see the Uber Eats that could go bring you some of these things. But we also started to see uh, delivery services for grocery stores, delivery services that's specific for liquor stores. It's taking from your mobile to your house without ever having to leave. And I put a couple of these images in there because that's kind of again back to the marketing and messaging. You see the picture of the cell phone pouring into your glass. So from your cell phone, you just swipe and hit a button, and then all of a sudden you have alcohol right in your hands from ordering, whether you're ordering from a restaurant or you're ordering from a grocery store or you're ordering from a liquor store. Delivery services, when you start to look at what those options are, this is one that would be able to go to the grocery store. But of course, you go to the website, and one of the first things you see is all the available options you have for alcohol. If you're going to the grocery store, you would think groceries would be the first thing that you would see on there, but it's actually the alcohol that's getting promoted. And also, I guess it depends on, that algorithm of what they're trying to do to market to you. Um, so we've got a couple of comments here. Yeah, so those mini bottles definitely they're as low as $1. And often I've seen them a few times where they promote them 10 for 10. So it looks like you're getting a really good deal on that. Um, Oh, that's a great point too. Yes, we have also seen the use of alcohol in nail salons and hair salons as part of the let's add to that unwind and relaxation. And again, pushing that concept and idea of unwinding and relaxing for women must mean alcohol. And we've got another comment here. Someone's favorite restaurant. They offer gallon margaritas to take. Yes, I have seen those as well. Um, and yes, the alcohol with the ice cream. Oh, putting it right in the self. You can go through the self checkouts. Let's see. And somebody mentioned there's a local restaurant in town where you can order a drink through the drive-through. And yes, definitely the alcohol being sold in movie theaters and not just beer and wine, but some movie theaters have full bars in them. So you can also get the rums and whiskeys and mixed drinks and all of that. So, as you can see, where we are today, we have all of these new things that have evolved. It's not just one thing that's happened. It's not just because there was a pandemic and that created all this. That just fueled what was already happening at the time. And it also, we saw the availability of the online platforms to really push and market. And once you get some of these delivery service apps on your phone, you'll notice they too also send out marketing messages. So as we've done research around this, I've downloaded several of these apps, and it is amazing how often the apps send messages to you. Uh, I've done one of them. It's a drizzly, which is specific to alcohol, and it will on a daily basis send messages. If you don't order something, it'll say, "We've missed you." Since when does an app miss me from ordering? And then it'll say things to kind of tie into the day of the week. Taco Tuesday is not complete without a margarita. Order today. Or feeling blue on Wednesday, order some Blue Moon. Or it's not quite Friday, let's prepare and have happy hour. Those kinds of constant messages on a regular basis. Um, it's all over. And all the different apps have all different types of messaging, but it's constant. And that's the thing about the online side is that we have constant information, instant information, and it's nonstop. And it's all over. There are so many different options that have become available. Like I said, delivery was around before, but now it's just available through so many different types of companies. And all of the different companies have different ways of marketing and promoting and all of that. But we do see this increased availability and access having a kind of a relationship to what we're seeing in the patterns. So we've added all these pieces of information that we've shared here with you today to kind of give you a better understanding of why do we see some of these patterns, but not only to know that we're seeing some of these trends happening, but also understand the dangers of what these trends mean. What these trends mean is if they continue to increase as they are, if we continue to see heavy consumption patterns, we'll continue to see the negative consequence indicators go up as well. That includes the medical examiner data, the hospitalization data, emergency department visits, um, the data that are collected for cancer, cardiovascular, liver disease, all of those indicators will continue to increase if we don't start addressing the issue around alcohol consumption and the dangers of overconsumption. And if we don't start to also talk about the importance of addressing mental health in all of this, then we're going to really not be able to provide and offer enough services because there will not be enough available services out there. Uh, the as we talk about how these changes in access and availability, we also have to talk about, well, how do we as our state also think about tracking this information? Who has oversight? We went from uh, just being able to deliver some pizza from time to time or your favorite restaurant to now we can deliver margaritas. We can get delivered uh, bottles of liquor from the liquor store. So many nuances have brought in all of these new questions of, well, where does the oversight happen for this? And it adds such an extra heavy burden for law enforcement because they already are overburdened with all of the things that they're charged with and doing compliance checks for just this, going to the stores themselves. Now we've added this new way of alcohol being made available through delivery services through the to-go drinks. So now we're also adding to their plate the ensuring some of these things that have been outlined in the policy, like proper container and correct labeling, making sure food is ordered with the alcohol, monitoring whether IDs are checked, and all of these things. There's a lot that kind of goes into this and understanding what can we do about it. So as we started to see this access and availability become quite widespread, we started to see a lot of articles coming out on warning about the dangers of some of these delivery services, especially for having minors being able to access alcohol. So I've included a couple of different articles that we were seeing that noted the reason for concern, and that's for of underage youth being able to access alcohol through deliveries, the regulation around this, what is available to that's happening out there. So we've included that information for you all. And then we took a look at with the to-go drinks, what are we seeing for access for those that are not 21? We took a look at, for those states that have done some of these compliance checks using decoys, similar to the way they do compliance checks of having someone underage go into a store and make a purchase. And this a couple of different investigations that were done. I've included again you can click on some of these to get to the hyperlink to go to the article. In Virginia, they did one of these undercover operations. They used 52 decoys. 32 of the underage buyers ended up with alcohol. California, they did something similar for one of their decoy operations, and they found that 79% of the delivery drivers gave alcohol to someone underage. Maryland also did this in one of their areas. They found that 55% of restaurants did not check curbside mystery shopper IDs. So as we start to look at this, we've been trying to find information for Florida. What does this look like? What are we seeing here? Because from what we've seen as far as articles about concerns, studies that have been done, decoys have been done in other places, we see that the majority of like the decoys and the things that we're finding are able to access alcohol without being 21. So I actually want to take a moment here and ask for those. We have Lots of folks joining us here today from all different parts. That's how we have as far south. We've got Miami. We've got as far up north as Nassau County and all the way across the Panhandle. So we have all these various locations. So I would like to ask you all to chime in into the chat. Uh, have you seen any concern around alcohol access for underage youth using delivery services? And or have you worked with your local ABT to understand if youth are able to access alcohol through delivery services? So if you have something to share around that, if you could type that into the chat, that would be great. Because as we look into what this means, we're trying to find a little bit more about, well, what does this look like for Florida? One of the things our organization has the opportunity to do right now is participate in a national alcohol policy academy. And we wanted to focus on the to-go drinks and delivery services, but we have not been able to find a lot of information on the data being collected around this. We just have some anecdotal information and things like that. But if anyone has seen some of this or has concerns about this, anything that you've shared with maybe your local ABT or questions you may have about this, we would love to get your thoughts, your input, your feedback about what you're seeing. Okay, it looks like so we do have some folks that have shared that they had a youth that was able to access alcohol, not at the age of 21. Bars near the college campuses are weak spots. Yes, we are also looking at that. We've done some environmental scans specifically around the university settings and working with some university partners to better understand that issue. So some delivery service do ask for IDs, and we have started looking at that as to what do the local policies look like for the companies. Some have ID check scanners, some just look at them, um, but it all varies. Okay, more information. You had to sign for delivery, but they didn't ask for name to verify and did not check, make sure it was okay. Excellent. Well, I'd like to put if this is a topic that you have some interest in learning more about or being a part of the work going to look at policy, please reach out. You'll have my contact information with the slides. We would love to have you be a part of our group that's looking into this. So thank you. We did add here a slide so you can get some information that we have found regarding compliance checks of establishments. So we've included some that was available online to give you an idea of what the compliance rates look like across some of the different communities that participated. This was an interesting one. So this looks at compliance check failure rates. So as far as us as a whole and as the state, we're doing relatively well compared to some of the other communities. That gets us to the last part of our conversation. So now what? Well, one of the things we want to make sure that we share out here, because part of what FATA and the Department of Children and Families wants to do is be able to not only share the data that we're seeing and the issues that we're seeing, but also what are the available options for resources and treatments out there. So looking at what the research recommends and suggests and finds to be effective is well, step one of starting with a primary care doctor. A lot of these screeners are available to be used in that type of a setting, that you can begin those conversations early on before you go too far down, where you have a lot of those issues coming through with some of the overconsumption patterns. Being able to offer a variety of different behavioral treatments, being able to offer different medication options, the mutual aid groups, Alcoholic Anonymous, and other 12-step programs, and of course, peer support. These are the research supported approaches to ways to work through alcohol use disorder, identify and provide those services and resources. So when we talk about primary care, that importance of screening, so screening, brief intervention, and referral to treatment protocol is the one way that it really helps to catch things early on. It does two things. What's nice is that it can be for anybody, anywhere, anytime. It doesn't have to be only for individuals who are at risk. Part of the screening process is to identify who's at risk, but the other part is also to be that positive reinforcement approach. So if we ask everybody the same questions, if we bring in screening as part of the way that we do this practice, then it normalizes the idea of talking through this topic. And then it also allows the opportunity to reinforce with a positive, you're making it, that you're on the right track. What you're doing is working. It matters. So it's great to have that. But and then as you go through, it allows for that opportunity to do brief interventions, to provide those reminders, to use that motivational interviewing skills, to be able to have those connections, to talk about what these dangers are, why we say, excessive drinking is harmful on the health side, why there's also a lot of need to share out what those resources are. And then the important piece of connecting to treatment as soon as possible and be able to help individuals move through that process. As far as behavioral treatments, there's a number of different evidence-based approaches, including cognitive behavioral therapy, motivational enhancement therapy, marital and family counseling, and brief interventions. Where there are also a number of medications that are available to help treat alcohol use disorder, naltrexone. So I've put these into two categories. You've got the FDA approved medications on one side, and then the other side are promising options. These are the medications that it's in research right now to see how existing medications that are for other things to be used to help individuals who have an alcohol use disorder. So I thought it was important to include both of those, the ones that are FDA approved, but also what the research is starting to see as some promising options to also be able to be used for this. And you'll be able to access all this information. We've included the hyperlinks throughout everything, and then also the listing of these resources at the end. There are a number of policy recommendations at the larger level of ways to help address alcohol and also be able to reduce some of the not just the consumption patterns, but also the consequences. So this includes regulating alcohol outlet density, minimum legal age of purchase, limiting days of hours of sales, increasing alcohol taxes, minimum pricing. And then we've got those that are the policies with moderate evidence. It's really important as we think through policies that we rely on what research is showing us is effective, not just what sounds like it could work. So having these things listed out here, just to give you an idea at a larger community level, these are the types of policies that would be effective. As far as the alcohol delivery side, looking at what options exist. This is a much newer piece. There are not a lot of there's not a lot of movement to really address this, though Washington State has recently passed some pretty good policy on addressing this because of what they were seeing in their data for having young people under the age of 21 being able to access it. So we're going to continue to look at some of those things to see what can we recommend here for our state and help to ensure that we are restricting the alcohol to those that are 21. Because if you recall that very first slide, young people who begin drinking before the age of 14 are more likely to exhibit some of those negative consequences. They're the ones that have, it sets them up for so many things that they're going to, it's like an uphill battle. They're the ones that are also more likely to experience that alcohol dependence and have an alcohol use disorder. So anything that we can do to keep young people under that age from accessing alcohol, I think is going to be great. We've added also in here a number of different resources. Number one, it's really important for us to remind folks that 988 exists. It can be called, it can be texted. This was a question that they added to the Florida Youth Substance Abuse Survey to see if young people, kids knew that this number existed, and then asked if they would be willing to reach out. And if there was not as much awareness of this as what we had hoped. So we really have to push and promote that 988 exists and it can be used at any time, anywhere, calling or texting. We've added the treatment locator in there. We've added some other resources. Today, we spent the last 2 hours talking about some of the trends and what are the different things that we're seeing, how alcohol and mental health, what that relationship looks like and how complex it is, how we're seeing the impact on women, well, between the marketing, the just where we are with what's going on in the world, the branding and the constant normalizing of drinking. So we've included here additional information. So alcohol facts and statistics, facts for teens, other resources available that are here, not just for the everyday person, but we also added some for healthcare professionals. So there's a website in here that gives some great resources on education, some training webinars and continuing education credits for that. Alcoholics Anonymous, we put in the Florida information, Smart Recovery, Women for Sobriety, and then we can't forget about our veterans. So we've added some resources in here as well so that we can provide that out to all of you. For everybody that's on the line here, you cover the entire state. So we hope with sharing this with you all, you can then also share out with your local communities and partners that you work with. The remaining slides that we have here are the resources that were used to put this slide deck together. We hope this information was beneficial to you all and that there's some good takeaways. If you have any questions on any of this information or you'd like to know a little bit more, we do have access to a lot of different data sources and can run some assessment analysis. We can share out some additional resources information and bring this to the groups that you work with. So I want to thank FATA for allowing me to be here today. I want to thank the Department of Children and Families for this opportunity to share out the importance of addressing alcohol, especially as we see some of the data that should be concerning all of us. So with that, Robert, I'm going to turn it back to you.
Thank you so much, Kathleen, for such a wonderful presentation and for the information you have shared with us today. Everyone, please hold for a moment for a few business items before we conclude. Again, thank you, Kathleen. We have included her contact information, kroberts@ccafl.org. I know some people had some questions regarding this material and different statistics. So if you'd like to contact her for more information, that is there for you. When I conclude today's webinar, your browser will pop up and ask you if you'd like to be redirected to a website. Please do not close your browser. It is trying to redirect you to the evaluation. If you want to receive CE credits or a statement of credit for this event, you must complete that evaluation. When you get redirected to the evaluation, you will be prompted to sign in or register for our website. You can register as a visitor at no cost by clicking Haven't Registered Yet. Please use the same email address you used when you registered for today's webinar when you set up your profile in our system. This is the only way to connect your attendance and your profile. After you register or sign in, you'll be directed onward to the evaluation. You will also get a second opportunity to complete the evaluation through an email later today. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, please provide an accurate Florida Department of Health license prefix and number the first time you register. If you need to add or update your license number, you may do so by logging in and clicking Edit on the Professional Information section of your profile. As a reminder, the evaluation will close at the end of the day on Monday, February 19th, 2024. If you experience difficulty logging into your account, accessing the survey, if your email is different, please fill out a contact form on our website as shown on the screen. You can also send an email to our team at training@floridabha.org before the evaluation closes. Please note that we do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. As a reminder, the recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording in PowerPoint, please visit www.fata.org, navigate to the Resource Center, and click on Training Library as shown on the screen. Thank you again to Kathleen for the wonderful presentation. Thank you to you all for participating in today's webinar. We'd also like to recognize and thank the Florida Department of Children and Families for funding today's education. Have a great day, everyone. Please hold for the evaluation.